Gentlemen, let's be honest. There are conversations that most men over 60 avoid, not because they're unimportant, but because they still carry a quiet sense of taboo. One of those topics is masturbation. Yet here's the truth. It's not only natural, it's essential to maintaining both physical vitality and emotional balance as you age. I'm Dr. Sophia Carter, and today I want to address this openly, without embarrassment, and with the respect your health deserves. Because while self-pleasure can continue to support prostate comfort, reduce stress, and even boost confidence, the way you approach it at 65 is not the same as at 25. Your body changes, sensitivity shifts, skin becomes less resilient, and certain habits that once seemed harmless may increase your risk of irritation, discomfort, or even long-term issues. That's why this discussion is about far more than pleasure. It's about protecting your most delicate tissues, sustaining healthy circulation, and ensuring intimacy, whether with yourself or a partner, remains safe, satisfying, and free from unnecessary risk. So today, I'll reveal the 3 most common mistakes men make when it comes to masturbation after 60 and what you can do instead to stay healthy and strong. Let's take a closer look at why safe masturbation becomes even more critical as you move past 60. Many men assume that what worked for decades will work forever, but the reality is that your body changes in subtle, yet meaningful ways. And if you don't adapt, what should be enjoyable can cause discomfort, or worse, set the stage for avoidable problems. Research shows that regular ejaculation may help reduce pelvic tension, keep the prostate more comfortable, and even improve mood by lowering stress hormones. Some studies also suggest it supports better sleep and circulation. But here's the nuance. Aging alters the landscape. As natural lubrication decreases, the skin on the penis becomes thinner and more fragile, and nerve sensitivity may decline. What once felt perfectly fine can now result in irritation or micro-tears if you're not careful. Think of it this way. A younger body can take shortcuts and recover quickly. After 60, the focus shifts to protecting your tissues and respecting your body's limits. Gentle care isn't a sign of weakness. It's a strategy for preserving long-term function. The men who remain mindful about their habits often report greater comfort, firmer erections, and a more profound sense of control over their sexual health. So, when you hear the phrase, safe masturbation, don't dismiss it as unnecessary caution. See it as an investment in your future vitality, one minor adjustment today that pays off in confidence and pleasure for years to come. The first and most common mistake I see men over 60 make is skipping lubrication, or using the wrong kind. When you were younger, this probably didn't seem like an issue. Natural moisture was usually enough, and your skin recovered quickly from minor friction. But past 60, your body doesn't provide the same level of natural glide, and ignoring this change can lead to unnecessary pain and even damage. Without proper lubrication, friction builds up faster. This can cause tiny cuts or irritation in the delicate penile tissue. Over time, these micro-injuries may contribute to conditions like Peyronie's disease, where scar tissue creates painful curvature. Even if you don't develop a condition that serious, you may notice soreness, redness, or reduced sensitivity, hardly the outcome you want from an act meant to bring relief and satisfaction. The safe solution is simple. Always use a high-quality lubricant. Water-based lubricants are reliable, easy to wash off, and safe with latex condoms. Silicone-based lubricants last longer, making them ideal if you have drier skin or prefer more extended sessions. Just remember, they shouldn't be paired with silicone toys. As for oil-based options, be cautious. While they may feel smooth at first, they can weaken latex and increase your risk of infection. The key is generosity. Don't hold back. Apply enough to protect yourself, and reapply as often as needed. Think of it not as an optional step, but as essential protection for your most sensitive and valuable areas. The second mistake many men over 60 make is relying on the same forceful techniques they used decades earlier. When you were younger, squeezing tighter or moving faster might have intensified sensation. But after 60, that approach often backfires, putting delicate tissues under unnecessary strain and sometimes leaving lasting damage. Think about what's happening inside your body. The erectile tissue, blood vessels, and nerves that create pleasure are no longer as resilient as they once were. Applying too much pressure or moving aggressively can bruise the tissue, overstretch the skin, or even compress the nerves. The short-term result may be lingering soreness or numbness. The long-term risk is reduced sensitivity or micro-damage that never fully heals. Ironically, the very technique meant to increase pleasure can diminish it. The healthier alternative is to slow down and shift your focus. Gentle, rhythmic movements often feel more satisfying than frantic pressure once you give your body time to respond. Some men even find that using both hands with lighter strokes or varying speed and pressure in subtle ways awakens sensitivity they thought was gone. It's about working with your body, not against it. Above all, listen to your body's signals. If you feel pain, tingling, or anything that seems off, your body asks you to stop immediately. Pleasure should never come at the cost of long-term comfort. This adjustment is not a restriction, but a smarter, safer path to sustained intimacy and satisfaction. The third mistake, and one that often gets overlooked, is neglecting proper hygiene after ejaculation. Many men see it as a minor detail. Still, in reality, this simple step can determine whether your experience leaves you comfortable or at risk for infections and irritation. Here's why it matters. After climax, residual fluids remain on the skin and around the urethral opening. If left uncleaned, these fluids can become a breeding ground for bacteria. For men over 60, especially those with conditions like diabetes or an enlarged prostate, this risk increases significantly. Urinary tract infections, skin irritation, or lingering discomfort can follow, turning what should have been a relaxing moment into a painful aftermath. The safe practice is straightforward. Always wash the penis and the surrounding area with warm water immediately after ejaculation. If you choose to use a cleanser, ensure it's fragrance-free, pH-balanced, and designed for sensitive skin. Harsh soaps or antibacterial products may seem practical, but they often strip away natural oils and cause dryness or irritation. And don't forget, drying thoroughly is just as important as washing. Moisture left in skin folds can also invite bacteria. This may sound simple, but it's an act of self-care that protects your comfort and your long-term health. Just as you wouldn't leave sweat on your skin after exercise, don't leave fluids unattended after intimacy. Cleanliness here isn't about overdoing it. It's about respecting your body and giving it the care it deserves. Now, let's step back and see the bigger picture. These habits, using proper lubrication, avoiding forceful techniques, and keeping hygiene in check, aren't just about avoiding short-term discomfort. They're about protecting your long-term sexual health and overall well-being as a man over 60. When you take care of these details, you do far more than prevent irritation. You're actively supporting healthier blood flow, protecting the delicate nerve endings that give you pleasure, and reducing the risk of scarring or infections that could limit intimacy in the future. Think of it as maintenance. Just as you'd tune up a classic car, you need to preserve the engine of your body with care and consistency. Here are a few reminders that make a difference. Always listen to your body. If something feels painful or unusual, don't ignore it. Those signals are your body's way of asking for attention. Second, be open to adapting. The techniques that worked in your 20s may not serve you in your 60s, but that doesn't mean pleasure is gone. Many men discover new sensations by slowing down and trying different approaches. Third, remember that frequency is entirely personal. No right or wrong number exists. What matters is comfort and fulfillment. And finally, never underestimate the role of hygiene in keeping everything working smoothly. These mindful adjustments are minor, but together, they protect your health, preserve sensitivity, and keep intimacy a source of strength rather than concern. Gentlemen, let's be clear. Masturbation after 60 is not only regular, it's healthy. The key is adapting to the changes your body naturally goes through. With the proper care, it can remain a source of comfort, vitality, and confidence for years. Avoiding common mistakes like skipping lubrication, being too aggressive, or neglecting hygiene isn't about restriction, it's about respect. Respect for your body, your health, and your future. When you choose to be mindful, you're not just avoiding pain, you're investing in better circulation, healthier nerves, and lasting sensitivity. You're proving that intimacy doesn't fade with age. It evolves. And that evolution can bring a deeper kind of satisfaction than before. So I encourage you, listen to your body, care for it, and enjoy the benefits of safe, thoughtful practice. And now, I'd like to hear from you. Have you noticed changes in sensitivity or comfort as you've gotten older? What adjustments have made the most significant difference for you? Share your experiences in the comments below. You might inspire someone who needs to hear it. Don't forget to subscribe, because in our following discussion, we'll tackle another important topic: low libido after 60 and practical ways to reignite your spark.